Hi there. We are here today to talk to you about the MariTime-CV study. My name is Erin Babula, and I am a cardiologist at the Brigham and Women's Hospital and an investigator with the TIMI study group.
And I'm Ben Surik. I'm also a cardiologist at Brigham and Women's Hospital and an investigator at the TIMI study group. So, Aaron, let's start. Tell us a little bit about the Maritime CV study.
Yeah, so the MariTime-CV study is a part of a larger program studying a drug called maritide. And this particular study, which is the TIMI 80 study, is looking at patients who have atherosclerotic cardiovascular disease, so who've had a prior MI, a prior stroke, or who have symptomatic peripheral artery disease. And they're being randomized either to the therapy or placebo and being followed for a number of years for major adverse cardiovascular events. In addition, I should mention that the inclusion criteria also requires that patients are either overweight or obese with a BMI of at least 27 or greater.
How big is this study and how many sites and countries?
Yeah, it's sizable. So we're anticipating randomizing about 13,000 patients across probably about 35 countries and over 700 sites, and we are anticipating following patients for as much as 3+ years. So an extended duration of follow-up, global, international, randomized control trial. And maybe I'll ask you a question about where this stands in the landscape of therapies to care for patients who are overweight or obese.
For sure. I mean, this has been, I'd say, one of the most exciting areas in medicine and certainly cardiometabolic medicine over the past decade, the development of the incretin therapies, specifically the GLP-1 studies. And as we'll talk about, this is a GLP-1 receptor agonist based therapy. We've seen a lot of studies in patients with diabetes with these drugs that not only do they improve things like weight and glycemic indices, but they also reduce cardiovascular events in patients with diabetes. And there was the SELECT study with semaglutide in patients with overweight and obese who do not have diabetes, where semaglutide reduces the risk of cardiovascular events in patients with established cardiovascular disease like this study. And so this sits well within a field where there are multiple agents now being tested across a wide spectrum of patients. And I think for our trial for Maritime CV, we have a broad population, patients with and without diabetes, who are at very high risk because they have established cardiovascular disease. So it's a great opportunity to be able to check the efficacy of maritide. And maybe tell us a little bit about maritide. It's a really unique and interesting medicine.
Yeah, completely. I think it's a fascinating story behind maritide. So as you mentioned, maritide is a GLP-1 receptor agonist based therapy. But interestingly, it has a second component to it, which is a GIP receptor antagonist. And targeting that as an antagonist or antagonizing that receptor was really born out of a number of genetic studies that suggested that that might be beneficial from a cardiometabolic standpoint. And so, there are multiple agents out there that are targeting multiple receptors, and this is the only one that is a GLP receptor agonist and a GIP receptor antagonist. And also interestingly, it's a bispecific molecule. So it's an antibody which antagonizes GIP, and then it has conjugated to that a peptide which agonizes GLP. And there is a good amount of data with this specific compound, which was that now we have phase 2 data in patients who are overweight or obese with and without type 2 diabetes. And what we know is that it's a very potent weight loss agent, and that it also has, really good efficacy in a number of sort of cardiometabolic profiles. So, for example, really significant reductions in A1C or hemoglobin A1C in patients with diabetes, improvements in lipid parameters, blood pressure, a number of other areas. So we are very excited to sort of take this now into the realm of looking at cardiovascular outcomes with this compound. And as you mentioned, the trial includes patients with type 2 diabetes, so sort of builds on the landscape that you described with GLP-1 therapies in that group, and then also includes patients who do not have type 2 diabetes, so more of a select-like population. And so we're super excited about this trial and what we might learn from it. Let me ask you, having described the mechanism of this compound and a little bit about the efficacy. Can you tell us about the safety side of things?
For sure. And the drug is an injectable. It's a once monthly injection. And like other drugs in this class, there are pretty common side effects that are well recognized, and they include things like nausea, some vomiting, constipation, or diarrhea that tend to happen as people start the drug, especially the first day or two after they get their first doses. And like all of these drugs, we titrated up slowly over many weeks and started a low dose and then work our way up. And what's been seen in prior studies and other studies in this class is that most people do tolerate the highest dose and get up to those high doses. And we anticipate and hope that that'll be the case in our study as well. The phase 2 data that you showed that the side effect profile is very consistent with all the other drugs in this class. But as you mentioned, it isn't without the cardiovascular study that we will be able to fully evaluate its not only safety and tolerability in a large, broad population, but also whether it'll reduce cardiovascular events.
Great. Well, thank you so much for joining us today.